they doing? Are films and TV shows doing a good job, a bad job? What's the overall outlook of what they do?
Well, I think Hollywood films, TV shows, etc., I think they're doing the best job that they can in trying to, again, make it interesting for the general public, but in doing that, they're pretty much getting most of the story wrong, I think. I think the biggest problem is the time factor. How labor and having a baby doesn't happen in an hour or, in the course of a TV show or movie, and they try and cram everything that could happen in a matter of 8, 10, 12 hours, 2 days in the time of their movie frame. So
I feel like every time you watch a movie where a woman is pregnant, the water breaks, and it's often in spectacular fashion. It's very dramatic, and then from what I understand, the water breaking often doesn't happen with that sort of drama. Can you talk a little bit about that and what the real...
Oh, absolutely. A lot of times, and you can, our staff on labor and deliveries across the country will tell you this, that a woman breaking her water, sometimes she doesn't even know if that has happened, or she's not sure, or a lot of times it's confused with just having a loss of urine on you, and they come into the labor and deliveries across the country sometimes 4 or 5 times during the pregnancy to get it checked out to see, did I break my bag of water? I'm not sure. And so a lot of times women don't know. Sometimes it is pretty almost like you dropped a water balloon. That happens, it does happen, and it can happen, but a lot of times it could be what we term like a slow trickle, where you just feel like you urinated on yourself and you're not sure, did you sneeze and lose urine and that's what it is, or did you break your bag of water? And another thing the movies always get wrong is the water breaks and the baby comes and the next hour, the next minute, and that does not happen at all. A lot of times, especially in women in labor, when the water breaks at home, they have a good little bit before the baby comes. I mean, some women who have 5, 6 babies and they know and they labor very quickly, and there are women like that. Yeah, they break their bag of water and they have a baby in 20 minutes. But that's not the norm at all.
Until my wife became pregnant was the mucus plug. And have you ever even seen that reference in any sort of capacity in TV or movies? It seems like that's something that just doesn't get all the notoriety.
No one really talks about the mucus plug in the media, in the films or TV show, and it's very real. I mean, a lot of patients, women will tell you, and how as physicians we look at the mucus plug is, if a woman loses her mucus plug, okay, labor is going to happen sometime shortly. Who knows when? It could be a couple hours. It could be a couple days. It's just the body's getting ready. So for us, it's kind of like, when a patient, sometimes they get quite hysterical about it and they come in, I lost my mucus plug. Oh, okay, baby's doing great, you're doing fine. Go on home and relax and you'll go into labor soon. Yeah.
It's a more physical warning sign.
Pretty much, exactly.
Maybe throwing up in the early stages, the morning sickness, that's pretty common, and I imagine fairly accurate.
Yeah.
What else do the films maybe do, either inadvertently or on purpose, when they get it wrong?
I think the one thing is that, unfortunately for a lot of women, pregnancy is really uncomfortable. And, I think Hollywood glamorizes pregnancy and it's wonderful, and a lot of women believe that, but there are a lot of women who don't like to be pregnant, who are uncomfortable, who just, they'd rather not be pregnant other than to have a child. It's not something they truly enjoy. And, as a physician, you have to take care of those patients. You have to let them know it's going to be over soon and help to calm them and to alleviate any aches and pains. It can be very uncomfortable. Walking up a flight of stairs is uncomfortable. And it's not just, I have a big belly. It's a lot of discomfort. So they really aren't happy. And Hollywood truly glamorizes it, especially with all the stars now being pregnant and they look all beautiful being pregnant. I've never seen any of my patients look that beautiful. So, it's just one of those things. It's funny.
Do they reach out to a doctor to kind of use them as a guide or as some sort of advisor? Or do you think that they often maybe go forward and don't use the experts and don't rely on their skills?
I would probably say they do search out experts. I actually know that one of the physician consultants on the show of ER, I knew way back when the show first started. So I think they're there, but again, they may use a general doctor, an ER doctor, maybe not a particular obstetrician. Maybe for the movie like Juno, because it really centered around the pregnancy, they would, look for an obstetrician. But like a general doctor who may not see that many pregnant patients and take care of them, who may not know the ins and outs, maybe, they may not get all that information. But I would be surprised if they don't at least contact a physician to get a sense as to what's going on. And especially if they want to focus on a bad outcome of pregnancy, they'll pick a topic, say preeclampsia. And so they'll talk to a doctor about preeclampsia, what it is, what usually happens in labor, and then they'll write that into the story. Without, again, the exact nuances and this and that, but they'll say, this is what preeclampsia is, this is what could happen, this is the medications you treat it with, and this could be the outcome. So they'll put that into the movie, and again, we're missing the fine points that make it more realistic.
The birth process is that the woman often will be at an angle so that gravity will sort of work with her and help. And I feel like whenever I watch a film or a TV show, they're either flat on their back or maybe their feet are in stirrups, but it doesn't seem like they're angled in quite the right way.
No, actually, position is very important, very, very important, and very rarely do women labor on their back. And again, depending on the type of environment you're having your baby in, I mean, we can go from a birthing center to an academic university, level 3 nursery. That's the whole spectrum. And in a more relaxed birthing center, patients are walking, they're sitting on a big ball, they're, walking up and down the hall, they're in the tub, and during the whole labor process and even giving birth that way. Some women just squat and give birth while on their feet. And when you're more in a, academic setting or a big urban community hospital, they're more times confined to a bed. However, they're definitely more sitting upright, not flat on their back. That is definitely the better position for delivery. And does gravity play a role at that point? Yeah, sometimes. Usually not that much, but sometimes.
Yeah. Do you have to correct patients from time to time?
Absolutely. Or they just don't know, and they'll be surprised when I tell them really how it works. And I know that they're surprised because they don't see that on TV. That's not how it works on TV. I think TLC had the birthing story, and that was a big hit because that was a little bit more real, of course. And so, again, even on that story, they would focus on a really, really good outcome or a really, really bad outcome. And so, I had the extremes there again saying, well, on birthing story, I saw when the woman died because of this. And I'm like, okay, that's not going to happen. So again, swayed a little bit by the media, but definitely whatever they see, they really do believe, people believe that's the way it is. And there is a conversation that happens with me and my patients about, how it's going to be, and this is the way it works, and you don't do this, or you do this. And the one thing, again, and you don't see this on TV, is the amount of people that are involved in the process. The amount of nurses, the amount of techs, the amount of doctors that are involved. It's not one nurse, one doctor a lot of times. A lot of times it's a lot more than that. And so, for a woman, it's a very vulnerable time, and seeing all these people come in and out can be a little shocking, so I make sure to kind of go over that with patients as well.
Any particular film or movie that sort of either did a really great job or a really lousy job with kind of capturing the moment of birth? We touched on a couple, but maybe another.
Yeah, the one thing that I thought was the best they did with time and how bad the woman looked, and when I say bad, how real she looked like, is that she was really going through birth. Actually, Sex and the City movie.
Oh, really?
When Miranda was giving, was it the movie or one of the episodes when she was giving birth? She really looked like she was giving birth. And exactly. And during the episode, Miranda looked like she was having a baby. I was just like, she was sweating and she didn't look very pretty and she didn't have any makeup on and she was all red. And yeah, that's kind of how it is.
Great.
Yeah.
Well, I want to thank you so much for taking a few minutes to speak to me. This is really interesting, and as a person weaned on movies, I've had my own education as my wife is preparing to give birth, but this is even better to get the full story of what's going on.
Sure, no problem. And good luck with everything next month.
Thank you. Yeah, fingers are crossed.
Okay, great.